Hi again, my dear students. This is Professor Eman Ahmed Zaky once more. I'm going to discuss the second part of my lecture. Hopefully, you are eager now to know what is meant by single gene disorders. By the end of the second part of my lecture, you should be able to identify the different types of single gene disorders, know the criteria of the different types of single gene disorders, and know how to manage patients with such disorders. A single gene disorder is the result of a single mutated gene. These mutant genes, if localized on autosomes, this will result in autosomal gene disorders, whether dominant or recessive. And if localized on the X chromosome, they will lead to the occurrence of X-linked disorders, again dominant or recessive. In autosomal dominant disorders, only one mutated copy of the gene will be necessary for a person to develop such disorders. Each affected person usually has one affected parent. The chance of a child will inherit the mutant gene in such a condition is 50%. Autosomal dominant conditions sometimes have reduced penetrance, which means although only one mutant copy is needed, not all individuals who inherit that mutation will go on to develop the disease. Examples of autosomal dominant disorders include Huntington disease, neurofibromatosis type 1 and 2, Marfan syndrome, hereditary non-polyposis colorectal cancer, hereditary multiple exostosis, tuberous sclerosis, von Willebrand disease, and acute intermittent porphyria. Now, what about autosomal recessive disorders? In such a condition, two copies of the gene must be mutated for a person to develop autosomal recessive disorder. An affected person usually has unaffected parents who each carry a single copy of the mutant gene. They are called carriers. Two unaffected people who each carry one copy of the mutant gene responsible for one of the autosomal recessive disorders will have a 25% risk with each pregnancy of having a child affected by that disorder. Examples of autosomal recessive disorders include albinism, phenylketonuria, galactosemia, cystic fibrosis, sickle cell disease, Tay-Sachs disease, Niemann-Pick disease, and spinal muscular atrophy. On the other hand, X-linked dominant disorders are caused by mutations in genes on the X chromosome. Only a few disorders have this pattern of inheritance, with a prime example being X-linked hypophosphatemic rickets. Males and females are both affected in these disorders, with males typically being more severely affected than females. Some X-linked dominant conditions, such as Rett syndrome, incontinentia pigmenti type 2, and Aicardi syndrome, are usually fatal in males, either in utero or shortly after birth, and are therefore predominantly seen in females. The chance of passing on an X-linked dominant disorder differs between men and women, and you will study this in your first day of the genetic course. The second type of single gene disorders that is caused by mutations of genes on the X chromosome is X-linked recessive disorders. Here, males are more frequently affected than females, who are usually carriers, and the chance of passing on the disorder also differs between men and women. X-linked recessive conditions can sometimes manifest in females due to skewed X inactivation or in cases of Turner syndrome. X-linked recessive conditions include hemophilia A, Duchenne muscular dystrophy, Leigh-Nihan syndrome, male pattern baldness, and red-green color blindness. The last type of single gene disorders is Y-linked disorders. They are also called Hollanderic disorders. They are caused by mutations on the Y chromosome. These conditions may only be transmitted from the heterogametic sex, that is to say, male humans, to their offspring of the same sex. More simply, this means that Y-linked disorders in humans can only be passed from men to their sons. Females can never be affected because they don't have Y allosomes. Y-linked disorders are exceedingly rare, but the most well-known examples typically cause infertility. Reproduction in such cases is only possible by medical intervention. Management of single gene disorders entails diagnostic measures and therapeutic modalities, each of which is further subdivided into symptom-specific and cause-specific. For example, in diagnosis of inborn errors of metabolism that are caused by autosomal recessive disorders, the diagnostic measures will depend on the detection of the accumulated metabolite, the enzymatic assay, and the detection of the mutation using molecular techniques, while symptom-specific will depend on the symptomatology of the child is suffering from. In cases of syndromes, for example, with congenital heart disease, you have to do plain X-ray, chest and heart, EKG, and echocardiography. On the other hand, for treatment of single gene disorders, it could be cause-specific, for example, aiming at prevention of recurrence of such disorders, or symptom-specific, for example, surgical correction of a congenital heart disease. You will further study the management of different single gene disorders during your journey in the pediatric curriculum. This was the end of the second part of my lecture, and now to part 3.